Hello, welcome once again to Moorgate Andrology. One question a lot of guys ask when they come with a bend in their penis and they're first diagnosed with Peyronie's disease is how does Peyronie's disease happen? How does Peyronie's disease happen? And they ask this because in many cases, guys have no idea how they came about this bending in their penis, which sometimes can be relatively slight, and in other cases can be really bad. The penis can bend like this, so that the sex life is compromised significantly because sexual intercourse is either very difficult and uncomfortable, or in worst cases impossible. So a lot of questions to be asked, and guys are seeking answers. Now, in some cases, guys can indeed remember how Peyronie's disease happened. They can recall some sort of injury or trauma to their penis at some point, probably a sexual incident where their penis was suddenly bent quite dramatically. And this causes an inflammation in the penis and a plaque of scar tissue to form. And this plaque causes the penis to bend on erection. When the penis is flaccid, you cannot see this bend, but when it's erect and the tissues are stretched, it causes this bend. So Peyronie's disease is caused always by some injury or some trauma to the penis. That's the key message, and how Peyronie's disease happens. It's caused by this injury or trauma to the penis. Now, it might be that if you've got Peyronie's disease and you notice this bending, you simply cannot recall the incident or when the trauma happened. This is quite common. We see a lot of guys at Moorgate Andrology for Peyronie's disease, and they have no idea how this disease happened. But rest assured, whatever or whenever it happened, it will have happened because of some sort of trauma to the penis. This is always a feature of this disease. Now, if you have Peyronie's disease, you will go through two phases. The first phase is an acute phase, where you will notice some pain on erection, some pain or discomfort on erection of your penis. And you may start to notice that your erections are not quite as strong as they were. And then, as time progresses over the following 12 months, you'll notice that you start to see some curvature, a curve appearing in your penis. And this curvature is gradual, but you may notice it get worse over time. Now, if you visit your GP, he will probably give you some medication to help with your erections and probably a penis pump to try and help straighten the penis. But these tend to have, on the whole, a rather limited effect. And after about 12 months, or when the penis has settled down, that is to say, you've had about 3 months with no worsening of this curvature, you may be considered for a minor surgery to straighten your penis. Now, the procedure on the National Health Service is something called a Nesbitt procedure. This is an established surgical procedure provided by the NHS to straighten a penis that's been compromised by Peyronie's disease. This is a surgery that will operate on the longer side of this curvature of your penis. Here is the shorter side, but the surgeon will operate on the longer side of your penis. By doing this, he will straighten the penis once more, but he will leave it shorter than it is now, typically by about 1 to 1.5 inches. Now, many men have a very successful Nesbitt procedure and go on to have very satisfying sex lives once more when this condition is treated. However, many men do not like the idea of their penis being much shorter in length. But thankfully, there is another technique that we perform at Moorgate Andrology that will straighten your penis but preserve its length. So, instead of operating on the longer side of your penis, we operate here on the shorter side. We make incisions to open up the penis and make it straight, and then in the hole that's left, a graft is placed, which acts as a scaffold for the formation of new collagen once more. This will straighten your penis and preserve its length. And this procedure again is called plaque incision and grafting. There are lots of medical papers written on this technique. If you look on the internet, you will find many medical papers which demonstrate the success of this procedure. Now, if you would like to know more about plaque incision and grafting, or indeed all aspects of treating Peyronie's disease, please get in touch with us here at Moorgate Andrology. We'll first arrange a consultation for you with one of our urologists who have experience in treating Peyronie's disease, so that you can consider all your options before making a decision about the best way forward for you. You can also find out more about Peyronie's disease by visiting www.moorgateandrology.co.uk. Well, that's all from me today. I hope that's given you an insight into how Peyronie's disease can happen and the treatment options for the disease. Until next time, I'll see you back here at Moorgate Andrology very soon. Bye for now.